Effect of drugs on the pathway of hypertension. Hypertension is a term used for blood pressure, which is a chronic medical condition. High blood pressure increases the risk of heart diseases and puts a strain on the heart, which leads to hypertensive heart diseases and coronary artery diseases, and the factors are listed below. Blood pressure is maintained by the force generated by the pump and the resistance in the distribution system, and also the amount of intravascular fluid. Resistance related to the size of the arterial bed. Also the dilating arterial reduces pressure. The system requires pressure monitors, which the kidney contains mechanisms to control blood pressure, which we'll go into later on with the types of drugs. Renin is converted to angiotensin, which affects vasoconstriction, mainly in the peripheral arterioles, which increases peripheral vascular resistance, thereby elevating blood pressure. In addition, renin stimulates release of aldosterone by adrenaline cortical cells in the glomerulosa. Aldosterone exerts an effect on the distal renal tubules, causing them to increase sodium reabsorption while secreting potassium. Retention of sodium increases fluid in the vascular system to maintain pressure.
As explained before, hypertension is a term used for abnormally high blood pressure in humans. People with a blood pressure reading between 120 to 139 for systolic and 80 to 89 diastolic are considered to have prehypertension. This can often be treated with lifestyle changes. However, patients who have a blood pressure equal to or over 140/90 may require with medication such as antihypertensive drugs. ABCD are antihypertensives. These drugs are used to treat and prevent the complication of high blood pressure, particularly the end point. Each of these classes of drugs work in different ways to reduce a person's blood pressure. Some of the most common ones are angiotensin-converting enzyme inhibitors, also known as ACE. These function by blocking the activity of angiotensin-converting enzyme by preventing the formation of angiotensin II. Angiotensin receptor blockers are also known as ARB. These block the binding of angiotensin II to prevent its effects, as well as increases the release of sodium and water into the urine, which also helps reduce blood pressure. Beta blockers, which block the action of sympathetic nervous system of the heart. Calcium channel blockers, which reduce the amount of calcium that enters the muscle cells. And diuretics, which are commonly called water tablets, help eliminate unwanted salt and water through urine excretion. These are explained in more detail in the following slides. Angiotensin-converting enzymes, also known as ACE, converts angiotensin I into angiotensin II, causing constriction of the blood vessels and therefore increasing blood pressure. When there is a drop in blood pressure, renin is released from the kidneys, which converts angiotensinogen produced in the liver into angiotensin I. When angiotensin I reaches the pulmonary system, ACE converts angiotensin I into angiotensin II. An increased production of angiotensin II causes constriction of blood vessels and therefore an increase in blood pressure. Once angiotensin II is activated, it then activates AT1R in the kidney, which causes sodium water retention as well as increased levels of aldosterone, which hence leads to an increase in blood pressure. However, ACE inhibitors prevent the formation of angiotensin II by blocking the conversion of angiotensin I into angiotensin II. When levels of angiotensin II are decreased, it leads to dilation of blood vessels, hence reducing the amount of sodium and water retention and therefore reducing blood pressure. However, ACE inhibitors also block the breaking down of bradykinin, which is a vasodilator substance. This means that there will be an increase in levels of bradykinin, hence causing side effects such as coughs. There are three common ACE inhibitors. These are known as lisinopril, enalapril, and ramipril. The term ARB stands for angiotensin II receptor blockers. These function to block the effect of angiotensin II by blocking the binding of angiotensin II on cell receptors. This causes dilation of blood vessels and therefore reducing blood pressure. This antihypertensive drug has the same effects as the ACE inhibitors. However, ACE inhibitors work by preventing the formation of angiotensin II rather than blocking the binding of angiotensin II to muscles on blood vessels. For some patients, these would be prescribed over ACE inhibitors due to its adverse and negative side effects. Beta blockers are also commonly known as beta antagonists, beta adrenergic antagonists, or beta adrenergic blockers. These are negative chronotropic drugs which help decrease heart rate and reduce blood pressure. Beta blockers reduce the workload on the heart by blocking the effects of sympathetic nervous systems on the heart. When a nerve is stimulated, the nerve ending releases chemicals known as epinephrine and norepinephrine, which stimulates the beta-adrenergic receptors. If the beta-adrenergic receptors on the heart, also known as beta-1 cardiac receptors, are activated, this tells the heart to contract very fast, causing an increase on the force and rate of the heartbeat, hence leading to hypertension. For this reason, beta blockers are used to reduce the sympathetic activity by blocking the binding of epinephrine and norepinephrine at the beta-adrenergic receptors. However, during this process, some beta blockers only partially activate the receptor, also known as partial agonist. This would decrease the contractility of the heart, which would lead to a lower stroke volume and therefore reducing blood pressure. Beta blockers also inhibit the release of renin, which is partly regulated by B1 adrenoreceptors in the kidney. This reduces the production of angiotensin II, which therefore enhances renal loss of sodium and water from the kidneys. Some common examples of beta blockers are as displayed.
Calcium channel blockers, unlike beta blockers, do not decrease the responsiveness of the heart to input from the sympathetic nervous system. Since moment-to-moment blood pressure regulation is carried out by the sympathetic nervous system, calcium channel blockers allow blood pressure to be maintained more effectively than do beta blockers. However, because dihydrofridrin CBS results in a decrease in blood pressure, the baroreceptor often initiates a reflexive increase in the sympathetic activity, leading to the increased heart rate and contractility. Diuretics work on the nephrons in the kidneys. Diuretics are substances that help the body get rid of water and sodium and decrease blood pressure. This is a diagram of a nephron in the kidney. So these the diuretics lower the plasma volume and lower stroke volume, which in turn lowers blood pressure. Osmotic diuretic drugs examples are mannitol and urea, and the main function of these drugs are to increase solute concentration within tubules. It follows the osmosis rule, where if you have a higher level of solutes within a particular area, more water would tend to go there. This diagram over here explains the process of osmosis inside the tubule of a nephron. When osmotic diuretics enters into the bloodstream, they're filtered at the glomerulus and enter the tubule, limiting the absorption of water in the tubule but increasing the osmolarity in the renal tubule. These increase the excretion of sodium, water, potassium, magnesium, and other substances. Loop diuretics, which work at a fixed ascending loop of Henle, or prevent sodium and chloride reabsorption. This diagram here shows part of the tubular lumen of a loop of Henle. This is achieved by competing for calcium ion binding sites. Chlorine binding sites, because magnesium and calcium reabsorption in the thick ascending limb is dependent on the positive lumen voltage gradient set up by potassium recycling through renal outer medullary potassium channel. Loop diuretics also inhibit their reabsorption. By disrupting the reabsorption of these ions, loop diuretics prevent the generation of a hypertonic renal medulla. Without such concentrated medulla, water has less of an osmotic driving force to lead the collecting duct system, ultimately resulting in increased urine production. Loop diuretics cause a decrease in the renal blood flow by this mechanism. This leaves less water to be absorbed into the blood, resulting in a decrease in blood volume. An example of the loop diuretic drug is bumetanide. Thiazide diuretic. So here is a diagram of the proximal tubule where thiazide diuretics act, and they do this similar to loop diuretics, but they're slightly weaker. There's actually very little known about why they dilate blood vessels, but it is known that blood pressure is lowered by the increase in urine flow and the increase in salt excretion. Potassium sparing diuretics are competitive antagonists. Here's a diagram again of a tubule. So these they either compete with aldosterone or intracellular cytoplasmic receptor sites, or directly block sodium channels. The former prevents the production of proteins that are normally synthesized in a reaction to aldosterone, and these mediator proteins are not produced, so stimulation of sodium-potassium exchange sites in the collection tubule does not occur. This prevents sodium reabsorption and the potassium and hydrogen ion excretion. Other drugs are listed above. Future research could be done on. When it comes to hypertension, so major strides developed to target 2 classes of genes to control hypertension. The genes are the following. You can read up there. The control of hypertension by targeting these genes through medication, which are reliable, cheap, and really good at reversing the action. Here is a list of some side effects from the therapy above mentioned. Incidence of hypertension and cardiovascular disease has been on the rise, as mentioned earlier. Latest research in hypertension is focused on genetic approach rather than the pharmaceutical approach. This is, in return, has given researchers a new perspective of hypertension. The genetic approach of hypertension is looking into the relationship between specific genes and biological pathways in mice. Why gene therapy? Gene therapy provides a powerful tool to influence the expression of a specific gene to compensate for the hypoactivity or hyperactivity of a defective gene. There's an example provided up there, and also delivery of each gene is either by naked DNA or by viral delivery, resulting in lowering of the blood significantly and some pathophysiology attenuations were observed in the major organs which are associated, for example, tubular dilation. Why RAS? Reasons for this are below. If you would like to have a read, that'd be brilliant. Due to this, there is a well-developed protocols which can be used to compare the outcome of gene therapy with traditional pharmacological inhibitors. In conclusion, gene therapy is the way forward, based on either inhibition of vasoconstrictor gene or overexpression of a vasodilatory genes, as it can give a permanent treatment or a possible cure. And here are references.
Thank you.